Today we'll discuss one of the topic, that is eicosanoids. What are these eicosanoids? Eicosanoids are the 20 carbon polyunsaturated fatty acids which are synthesized from an unsaturated fatty acid called as arachidonic acid. Arachidonic acid is also an unsaturated polyunsaturated fatty acid from which these eicosanoids are formed. And these eicosanoids are chemically 5, 8, 11 and 14 eicosatetraenoic acid. Let us see this one of the class of these eicosanoids, that are prostaglandins. What are these prostaglandins? These prostaglandins also are 20 carbon polyunsaturated fatty acids which contain a pentanoic ring. We'll see the structure in the later slide. Now, why these prostaglandins or how these prostaglandins are discovered? These prostaglandins mainly act on the smooth muscle tissue. So that is the reason from which they are discovered and they are given a name called as prostaglandins. And these prostaglandins are usually produced by all mammalian cells except RBC. And these prostaglandins are produced or they are synthesized in the body according to the situation, or if inflammation, for suppose if an inflammation response is formed or if an injury is observed, then these prostaglandins are produced, and these are produced in very minute amounts and they are not stored. Once they are released from the body, they show their or they exert their action and they are excreted from the body if any. Let us see the classification of these eicosanoids. Eicosanoids are classified into two types. One are prostanoids and the other one is leukotrienes or lipoxins. Prostanoids. These prostanoids are further classified into prostaglandins, prostacyclins and thromboxanes. We will discuss in detail about the class of eicosanoids that are prostaglandins. So, I told you that prostaglandins contain a pentanoic ring, that is 5 carbon ring along with a side chain. So, this is a 20 carbon atom and we can see that the OH rings, that is hydroxyl group rings, are present on the carbon atom or on the 15th, 11th and 9th carbon atom, and a carboxyl group, that is COOH group, is present on the first carbon atom. And we can also see at the position of C13 and C6 there is a trans double bond ring is present, and the main action of these prostaglandins are due to the C13 trans double bond which is present on the C13 carbon atom and the OH group which is present in the C15 carbon atom. So, these prostaglandins, I told you, these contain cyclopentane ring, and the main action of these prostaglandins are due to the presence of hydroxyl group which is present on the 15th position and trans double bond which is present on the 13th position. Let us see the biosynthesis, how these prostaglandins are formed. So, I told you prostaglandins are formed from a polyunsaturated fatty acid which is called as arachidonic acid. These arachidonic acids are released from the phospholipid membrane because of the action of an enzyme called as phospholipase C. When this phospholipase C acts on the phospholipid membrane, it releases arachidonic acid. And this arachidonic acid undergoes two pathways. One is cyclooxygenase pathway, which is also called as COX pathway, and the other one is lipoxygenase pathway, which is also called as LOX pathway. So, from these cyclooxygenase pathway, the prostanoids are formed, and from lipoxygenase pathway, leukotrienes and lipoxins are formed. So, if we see arachidonic acid, when cyclooxygenase enzyme is acting, and this COX enzyme is present in two forms, COX1 as well as COX2. So, when this cyclooxygenase enzyme acts, it forms prostaglandin H2. And from this prostaglandin H2, PGD2 is formed by the action of an enzyme called as PGD synthase, and PGE2 is formed by the action of the enzyme called as PGE synthase. And from this PGE, PGF2 is formed, and from PGH2 directly prostacyclins are formed and thromboxanes are formed. And in the lipoxygenase pathway, first the arachidonic acid lipoxygenase enzyme acts, where it forms HPETE, that is hydroxy peroxy tetraenoic acid, from which the leukotrienes are formed. First, let us see in detail about cyclooxygenase pathway. So, cyclooxygenase enzyme is present in two forms, as I told you, COX-1 as well as COX-2. COX-1 is a constitutive form and COX-2 is an inducible form. In the sense, the COX-1 enzyme is formed when there is inflammation or injury observed in the body, and it is present in the body, however. But COX-2 enzyme is present on the site of action, or it is released locally when there is any injury or when there is any inflammation in the body. And this COX-1 enzyme is present in mostly all type of cells, but COX-2 enzyme is present, or it is mainly released in the kidney and CNS system only. As I told you, it is released locally and it exerts its actions, and thereby it is eliminated from the body if any remains. Let us see the classification of these prostaglandins. Prostaglandins are classified into PGE, D, F as well as PGA-B also. We'll see the subclasses of this. PGE group is further classified into PGE1, E2 and E3, and this PGE is categorized based on the beta hydroxyl ketone which is present. We saw the penta cyclopentane ring or tetraenoic acid ring. So on that, when on the beta position of the carbon atom, if hydroxyl ketone is present mainly on the C15 ring, where when the hydroxyl group is hydroxyl ketone group is present on the beta position, then this PGEs are formed. And PGF are further classified into PGF1 alpha, F2 alpha and F3 alpha. This PGE2 are mainly categorized by the functional group called as 1 and 3 diols. That is, when on the first position and third position, if hydroxyl group is present, OH group is present on C1 and C3 carbon atoms, then this PGF2 are formed, and PGA2 are further classified into PGA1, A2 as well as 19OH PGA1. That is, on PGA1, if on the C19 carbon atom, if hydroxyl group is present, then this PGA1 19OH type of PGA1 is formed, as well as the same PGB are further classified into PGB1, B2 and 19OH PGB1. That is, on PGB1 prostaglandin, if on this C19 carbon atom, if OH group is present, then this type of prostaglandins are formed. And there are main three physiological effects of these prostaglandins. Overall, these prostaglandins show three type of physiological effects. One is inflammation, the other one is pain and fever, and the other one is reproduction. With these, especially when inflammation is observed, PGE2 and PGI2 type of prostaglandins are released because of the injury or because of the damage to the tissue, and they are released, they exert their action, they show vasodilation or vasoconstriction based on the tissue present, and thereby they exert their action. Pain and fever. PGE2 and especially PGE2 is released when pain and fever is observed. See, the body temperature is regulated by hypothalamus, which is present in the brain. In the brain, there is a part called as hypothalamus, where the pain or fever is regulated. So when PGE2 is released in the body, it potentiates, in the sense it adds additional fever and pain because it acts on the hypothalamus, and whereby PGE2 is released, and this PGE2 mainly acts on the hypothalamus, whereby the potentiation of fever and pain is observed. And in reproduction, especially PGE2 and F2, they mainly act in the termination of pregnancy, and they especially exert their action in the male infertility. Overall functions of these prostaglandins include inflammation. Mainly these prostaglandins exert inflammation. They act on smooth muscle tissue, and they act on GI secretion. That is, when especially PGE2 and PGI2 are released, more amount of gastric acid secretion is observed. And blood coagulation. These prostaglandins play an important role in blood coagulation also, and they play an important role in reproduction. These prostaglandins have to have some source of mediation by which they have to act. So these prostaglandins mainly they bind to the prostanoid receptors and they exert their action. These prostanoid receptors are also, there are 5 types of prostanoid receptors. That is DP receptors, FP receptors, TP receptors, thromboxane receptors and EP receptors. So DP receptors are the receptors where PGD2 bind to that. EP receptors are those where PGE2 type of prostaglandin bind, and FP receptors are those type of receptors where PGF2 alpha binds, and IP receptors are those where PGI2 type of prostaglandin bind to that, and TP receptors are those where thromboxane type of prostanoids bind to those receptors and exert their actions. And all these prostaglandins or prostanoids bind to such kind of receptors which are GPCR, that is G protein coupled receptors. These are type of the receptor. There are mainly 4 types of receptors: nuclear receptors, ion channel receptors, and kinetic type of receptors, and G protein type of receptors. So G protein type of receptors are those receptors mainly they exert their action by 2 type of pathways, that is cyclic GMP pathway and inositol triphosphate pathway. So when this prostaglandins bind to those receptors, cyclic AMP or cyclic GMP is converted to AMP or GMP, and thereby where the constriction or else dilatation of a particular muscle tissue takes place. So these are GPCR type of receptors where these prostaglandins bind and exert their action. And these eicosanoids or prostanoid synthesis is done mainly on the tissue damage. Where there is any tissue damage, then these prostaglandins are synthesized in the body, or they are even synthesized when there is a transmitter release like bradykinins. These are the allergens which are released in the body, and when these transmitters are released, also these prostanoids are released in addition in the body. Let us see the individual actions of these PGs, that is prostaglandins. So first category of PGs is PGE2. It has various several actions. It acts mainly on the GI smooth muscle. It acts on the uterine muscles. It acts on the heart muscles, and it has various other functions also. Like first thing is like the contraction of bronchial muscle. So on the bronchial tissue, when these PGE2 acts on the bronchial tissue, it causes bronchoconstriction. In the sense, it constricts the bronchial smooth muscle. That is the reason these prostanoids are contraindicated in the condition of asthma. And few of the prostaglandins, they even PGE2 are further have PG2 alpha and PG2A and PG2B are also there. So in these type of PGEs also there are few prostaglandins which causes bronchodilation. So especially PGE2A, it causes bronchoconstriction, and remaining PGE2 class of prostaglandins causes bronchodilation, and it causes relaxation of the smooth muscle, gut smooth muscle in the abdominal wall or in the gut wall. The smooth muscle, when these PGE2s are released, then it causes relaxation of that muscle, and it fertilizes or it facilitates ovulation and fertilization. So these prostaglandins play an important role in reproduction also. So in females, it causes ovulation and fertilization, and GIT secretions, the secretions of the GIT. There are various secretions like pancreatic secretions and gastric juice secretions and intestinal secretions. There are various secretions which are present in the GIT. So these secretions are potentiated when this PGE2 is synthesized in the body, and it inhibits lipolysis because these PGE2 act on polyunsaturated fatty acids. These are polyunsaturated fatty acids. They inhibit the lipolysis of other polyunsaturated fatty acids, whereby the deposition of fat is prevented. And the action of, let us see the actions of few of the actions of PGD2. So PGD2 it specially acts on DP receptors, whereas PGE2 it acts on EP receptors as well as it acts on all the other type of receptors also. But this PGD2 it specially binds to only DP receptors, that is PGD2 receptors, and where it causes vasodilation. It causes the dilatation of the vascular smooth muscles and it inhibits platelet aggregation. The platelet aggregation is inhibited, whereas PGE2 potentiates platelet aggregation, but PGD2 it inhibits platelet aggregation and relaxation of smooth muscles of the gut, smooth muscles of the GIT as well as uterine smooth muscles. Whatever the smooth muscles are present in the body, these are relaxed when PGD2 acts or it is synthesized in the body, and it causes bronchoconstriction. It strictly constricts the bronchial smooth muscle. Let us see the actions of PGI2. This PGI2 also, it specifically binds to IP receptors only. It does not bind to other receptors like PGE2. And it also causes vasodilation. It also inhibits the platelet aggregation. The platelet aggregation is inhibited, and it has an additional action called increased renin release, because few of the prostaglandins are released in the kidney, these are synthesized in the kidney and CNS, because if COX2 enzyme acts, or else the prostaglandins which are formed by the action of this COX2 enzymes, they are synthesized in the kidney as well as they are synthesized in the CNS. So that is the reason this PGI2 is such a kind of prostaglandin which is synthesized in the kidney, and mainly it is responsible for increased renin release, and this renin is especially useful in the conversion of angiotensinogen to angiotensin 1, which is a potent vasoconstrictor. So if a person is suffering from hypertension, then PGI2 is not recommended, because this PGI2 potentiates renin release, where it causes or it potentiates vasoconstriction, and shows an action called as natriuresis. Next, PGF2A. PGE2 as well as F2 have two types, PGF2A, F2B, and PGE2A and PGE2B. So this PGF2A is more useful, and it exerts its actions, or else it shows such kind of actions called as bronchoconstriction as well as uterine smooth muscle contraction. So as PGD2 and I2 show relaxation of the smooth muscle, but this PGF2 shows constriction of the bronchial smooth muscle as well as uterine smooth muscle. Actions of thromboxanes. The name itself indicates thromboxanes are such a kind of prostanoids, or else such a kind of eicosanoids which are mainly useful in the platelet aggregation. So this platelet aggregation plays a very important role when thromboxanes are released. When thromboxanes are released in the body, then more amount, or else the platelet aggregation is potentiated in the body, and it causes bronchoconstriction as well as vasoconstriction also. So vascular smooth muscle as well as bronchial smooth muscles are constricted because of these thromboxanes. Let's see the biological effects. What are the overall effects of these or individual actions of these prostaglandins? Let us see what happens if to a tissue or a smooth muscle when these prostaglandins are released. So for example, let us see the cardiovascular system. What happens when these prostaglandins are released, or else when prostaglandins are synthesized in the body, what happens to the cardiovascular system? So when PGD2, E2 and I2 are released in the body, they causes dilatation of vascular smooth muscles. We saw this action in the individual actions also. So these prostaglandins causes vasodilation. So when these prostaglandins are synthesized in the body, then they cause vascular dilation, whereby there will be increased blood flow, and thereby the blood flow, or else the blood pressure will be regulated when these prostaglandins are synthesized in the body. But when coming to the thromboxanes, we saw it is a vasoconstrictor. So thromboxanes should not be given in hypertension or cardiovascular diseases because it causes constriction of vascular smooth muscle. There occurs narrowing of the blood vessel, and thereby the blood flow will be rapid. And thromboxanes as well as PGI2 are potent platelet aggregators, inducers as well as inhibitors. In the sense, thromboxanes and PGI2. So these play a major important role in platelet aggregation. So if there is a heavy hemorrhage or heavy blood loss, when these thromboxanes are released in the body, or PGI2 is released in the body, whereby the platelet aggregation is inhibited. But in some cases, in few of the cases, this platelet aggregation can be potentiated also because of these prostaglandins. And this PGI2, E2 and NO, that is nitric oxide, are simultaneously released from the endothelium. So if PGI2 and E2 are released in the body, then simultaneously NO, that is nitric oxide. As I told you, this COX pathway, in the cyclooxygenase pathway, the cyclic GMP or cyclic AMP is converted to GMP or AMP. Because of that, the nitric oxide, which is a potent vasodilator, when this NO or nitric oxide is released in the body, then it causes vasodilatation, and thereby the vascular smooth muscles are dilated, or the blood flow will be in a normal or else in a proper manner. But over secretion or over synthesis of these prostaglandins may cause increased vasodilation, which leads to hypotension, which is not recommended for a patient or for a normal human being. Let's see the actions of these prostanoids on smooth muscle. So most of the prostaglandins like PG, E2, D2, I2 and thromboxanes, they are potent, or else they causes constriction of the smooth muscle. So bronchial muscle relaxation by PG, E2 and I2, but constriction will take place by thromboxanes and leukotrienes. So PG, E2 and I2 are causing bronchial dilatation, but few of the PGE2 cause bronchoconstriction. But when coming to PGD2 and I2, they causes bronchial dilatation. In the sense, the dilation of these bronchial smooth muscles is observed. So that is the reason in asthmatic conditions, few of the prostaglandins are recommended. But thromboxanes and leukotrienes are such a kind of eicosanoids which causes constriction of the bronchial smooth muscle. And human pregnant uterus is also contracted because of the PGE2. So there are few of the prostaglandins which causes constriction of the uterine muscle. Let us see the actions of these prostaglandins in GIT. So initially we have discussed that these prostaglandins increase GI secretion. So there are various secretions. There are pancreatic secretions, gastric acid secretions. So when these prostaglandins are released or synthesized in the body, they act on the gastric cells, and thereby these the gastric acid secretions are secreted in more amount. But there are few of the prostaglandins which act on the gut muscle, where they causes muscle relaxation of the GIT. So they increase bicarbonate as mucus as well as blood flow also. So this mucus secretion is released, or mucus secretion is potentiated, and bicarbonate ion secretion is potentiated. So in gastric acidic condition, when this bicarbonate ion secretion is more, then what happens? This bicarbonate ions neutralizes the HCl which is present in the stomach, and thereby the acidity can be reduced, and it causes mucus secretion. When mucus is secreted in adequate amount, then the ulcers can be prevented in the GIT, and increased electrolyte or water movement into the intestinal lumen. So this water as well as electrolytes mainly are reabsorbed in the body. We have discussed this point while discussing diuretics. So most 99% of the electrolytes and water are getting reabsorbed in the body, and 1% is eliminated from the body. So this excessive amount of water and electrolytes which are entering into the intestine, the over transportation of these water and electrolytes are also prevented because of these prostaglandins when synthesized in the body. And thromboxane is a pro-ulcerogenic agent because when these thromboxane have such an action of GIT that it potentiates ulcers. Let us see the actions of these prostaglandins in the renal system. So, the prostaglandins which are formed by COX-2 pathway, or else the prostaglandins which are synthesized by the action of COX-2 enzyme, they are mainly secreted or synthesized in the kidneys as well as CNS. So, when these prostaglandins are released in the kidneys, it causes renin release, or increased renin is released in the body. When excessive amount of renin is released, it converts the angiotensinogen, which is released from the liver, and to angiotensinogen 1. And this angiotensinogen 1 is in turn converted to angiotensin 2, which is called as renin angiotensin aldosterone system. So, when this angiotensin 1 is released in the body, then angiotensin 1 or angiotensin 2 is a potent vasoconstrictor. It causes constriction of the vascular smooth muscle. Thereby, it causes high blood pressure or leading to various cardiovascular disorders. So, these renin, the excessive secretion of these prostaglandins are not recommended. If at all they are excessively secreted in the body, then inhibitors of these prostaglandins are recommended. The prostaglandins which are synthesized by COX-2 enzyme, they act on central nervous system also. So in the central nervous system, there is a region called as hypothalamus where fever and pain are regulated. So if in the case of fever and pain, pyrogens are entered into the body. So when pyrogens are entered into the body, these pyrogens potentiate to release or synthesis of prostaglandins, especially PGE2 and I2. So, when these pyrogens are given, or when these antipyrogens are given, like NSAIDs, NSAIDs and analgesics. NSAIDs are antipyretic agents and analgesics are anti-pain agents. So, when these are given, then this pain and fever are regulated, thereby prostaglandin synthesis is reduced. Let us see the therapeutic uses of these prostaglandins. What are the uses we can observe when prostaglandins are given? So, these prostaglandins mainly have a therapeutic use called as uterine stimulation. So, when these prostaglandins, especially a drug called as dinoproston contain a prostaglandin PGE2. So, this dinoproston is marketed as a vaginal suppository. So when these vaginal suppositories are given, then it causes abortion at the 2 to 12th week of the pregnancy. So if a pregnant woman takes this dinoproston, it causes abortion. And these are marketed usually as a vaginal suppositories. And the other one is Prostin E2 oral tablets. So these oral tablets are given for elective induction of the labor. So if at all, if there is natural labor is not observed, then Prostin, that is PGE2, is recommended to be given to the pregnant women for natural labor. And the action of these prostaglandins, that is prostin or dinoproston, is observed especially in 18 hours. The onset of action of these prostaglandins are observed by 18 hours. And there is other type of prostin also, oral tablets as well as vaginal gel of prostin is also marketed. And carboprost contain PGF2 alpha. PGF2 alpha is present in the marketed formulation called as carboprost, and it is usually recommended in IM route. In the sense, it is given through intramuscular route for the abortion between 12th to 20th gestation periods or 12th to 20th gestation weeks of the pregnant women. And the dose of this carboprost is about 250 microgram for every 1 to 3 days. Dinoprost contains the prostaglandin PGF2 alpha. So this PGF2 alpha is given mainly in the intramuscular route, that is IM route, or it is also given by intraamniotic route. In the sense, it is directly given into the amniotic membrane of the fetus, and it is used to induce labor or it is used to induce abortion also. Let us see the actions of these prostaglandins in the GIT. GIT, smooth muscle we have observed. Now we will see the GIT secretions also. The overall prostaglandins causes, I told you, causes the GIT secretion. So what are the uses of these prostaglandins in GIT? So misoprostol contains PGE1. So dinoprostone is a marketed formulation which contains PGE2, whereas misoprostol is a marketed formulation which contains PGE1. It is used to prevent drug-induced acid ulceration. So gastric ulceration is also formed because of few of the drugs. The acid secretion is potentiated, whereby gastric ulceration is observed. So when this misoprostol is given in the GIT, it prevents the acid-induced ulceration caused by the other drugs. For example, NSAIDs. NSAIDs are such drugs which potentiates the secretion of gastric acid in the stomach. So the NSAID action is nullified by the action of these prostaglandins in the GIT, but it is not recommended for pregnant women. Platelet aggregation. So these prostaglandins also play a very important role in platelet aggregation. For example, prostaglandins like PGI2 and PGE1. So PGI2 is marketed by the name called as epoprostol. Epoprostenol is such a marketed formulation which contains PGI2 as its main ingredient. So it is used to replace heparin. This heparin, what does it do? Heparin is an anticoagulant agent. So when this prostaglandins PGI2 is given, then what does it do? It replaces heparin and it binds to the heparinoid receptors, and thereby it exerts its anticoagulant action because it inhibits platelet aggregation. And PGE1 is also marketed as alprostadol. Alprostadol is such a marketed formulation which contains PGE1 and it is mainly used in the impotence. There are various analogues of these prostaglandins also. Let us see the analogues of these prostaglandins. So PGE1 is containing various analogues like misoprostol, ripoprostol and alprostadil and lubiprostone. So individual analogues have their various actions. For example, misoprostol, ripoprostol and enprostol, they are mainly useful in gastroprotection. So these type of analogues of PGE1 are recommended for protecting gastric acid ulceration. And gimiprost is such a kind of PGE1 analog which is obstructive purpose, in the sense it's specially used in the obstructive purpose. And alprostadil is such a PGE1 analog which is used as smooth muscle relaxant. It is used in impotence also, as well as it is used as an antiplatelet agent. And lubiprostone is such a PGE1 analog which is mainly used for constipation. PGE2 analog, dinoprostone. Dinoprostone is the only PGE2 analog which is marketed, and the action of these dinoprostone, especially it is used in the pregnant women for abortion. And PGF2A analogs. There are various analogs of PGF2A. That first one is dinoprost and the other one is garboprost, and latanoprost, travoprost, bemoprost, as well as uniprostone. So these are used for two purposes. One is for abortion in the pregnant women. The other one is ophthalmic use. So few of these PGF2A analogs are used in the ophthalmic preparations for the dilatation of the eye. PGI2 analogs. So PGI2 analogs are isinoprostol, biraprost, treprostinol and iloprost. So epoprostenol is used as an antiplatelet agent, and especially it is used in primary pulmonary disorder, as well as iloprost is used as an antiplatelet or anti-aggregation agent, and treprostinol is used in primary pulmonary hypertension, and biraprost is used in pulmonary vascular disorders. So these PGI2 analogs have mainly, or they exert mainly their actions in the cardiovascular diseases or cardiovascular disorders. Let us see the adverse effects of these prostaglandins. So each and every drug has its own adverse effects. So the main adverse effects of these prostaglandins are the side effects of these prostaglandins are common. The general usual side effects or common side effects include headache, wheezing, cough, as well as nausea, vomiting, diarrhea. These kind of common side effects are observed. But when coming to carboprost, it has a special side effect called as bronchoconstriction. So when bronchoconstriction, or if a patient is suffering from asthma, then this carboprost is strictly prohibited. And if it also have few of the prostaglandin analogs have a side effect of uterine cramps. So if that is the reason these few of the prostaglandins are not recommended for pregnant women, and they causes fever and shivering. These are also common side effects which are observed by these prostaglandins. Till now we have discussed about cyclooxygenase pathway in detail. Now let us see about lipoxygenase pathway. So leukotrienes are the another class of eicosanoids which are synthesized from arachidonic acid by a pathway called as lipoxygenase pathway or LOX pathway. So when these arachidonic acid is when this lipoxygenase is acting on arachidonic acid, it forms HPETE, that is hydroxyperoxytetraenoic acid, hydroxyperoxytetraenoic acid. So from this the leukotrienes, that is LTE4, LTD4, LTC4, LTB4 are formed. Lipoxygenase catalyze the addition of oxygen to double bonds of arachidonic acid, forming hydroxyperoxytetraenoic acid. So when the arachidonic acid, when the lipoxygenase is acting on the arachidonic acid, it forms double bond rings whereby HPETE is formed. HPETE, that is hydroxyperoxylipoxygenase, it is observed in 4 forms, that is 5 HPETE, 12 HPETE, 15 HPETE, 11 HPETE. What are these? If eicosanoic ring is observed in C5, or else if there is a double bond present on the C5 carbon atom, then 5 HPETE is observed. So the number of this eicosanoic acid is given based on the group which is present on the carbon atom ring. This 5 HPETE is converted to LTA1, that is leukotriene A1, which is further converted to LTB4 as well as LTC4, and from 12 HPETE the hypoxylins A and hypoxylins B are formed. These are also type of leukotrienes or lipoxanes which are synthesized by the LOX pathway. So when this lipoxygenase is acting on the arachidonic acid, initially it forms LTA4, that is leukotriene A4, and from this leukotriene A4, LTB4 and LTC4 are synthesized, and from 12 HPETE, these leukotrienes are formed from 5 HPETE. From 12 HPETE, hypoxylins A and hypoxylins B are formed. Let us see the types of these leukotrienes. There are various types of leukotrienes are present in the body, that is LTA4, B4, C4, D4, E4 and F4. What are the functions of these leukotrienes? So these leukotrienes are mainly used in 2 types of functions. One is asthmatic and allergic reactions, and the other one is sustained inflammatory reactions. So these leukotrienes are observed mainly, or else if a patient is suffering from asthma or allergic conditions, then these leukotrienes are released in the body. If the histamine is released in more amount also, then leukotriene are synthesized in the body in adequate amount. So these are mainly used in allergic reactions, and they sustain inflammatory reactions. And if inflammation is observed in the body, and if leukotrienes are synthesized in the body, then the inflammation is sustained for a longer period of time. What are the uses, or what is the relation between the leukotrienes in asthma? So first one, airflow obstruction. If a person is suffering from asthma, so it causes bronchial constriction, or the airflow is obstructed in asthmatic condition. So when these LTs or leukotrienes are released in asthmatic condition, then airflow obstruction is potentiated and increase the secretion of mucus. When mucus is secreted in increased amount also, the mucus is formed on the bronchial walls, and thereby it causes narrowing of the bronchial smooth muscle, and it causes mucosal accumulation. So when mucosa, if excessive mucosa is present, usually it is eliminated from the body. So if mucosal accumulation takes place in the bronchial wall, then what happens? Narrowing of the bronchial muscle takes place, thereby it causes constriction of the bronchial muscle, and infiltration of inflammatory cells in the airway wall. So in the airway wall also there will be inflammatory cells. Each and every organ of the body contains inflammatory cells. So this, it causes it potentiates inflammation, or else it sustains inflammatory action of these inflammatory cells, where increased obstruction of this airway is observed in asthma conditions. So that is why leukotrienes are not recommended in asthmatic conditions. Leukotrienes therapeutic importance. So there are no specific therapeutic importance for leukotrienes, but the leukotriene antagonists are recommended in asthma condition. Let us see the leukotrienes receptor antagonists. So like prostaglandins, similar to prostaglandins, these leukotrienes also bind to those leukotriene receptors and exert their actions. So when in order to inhibit the action of these leukotrienes, leukotriene receptor antagonists are given. So these leukotriene receptor antagonists, they prevent the binding of the leukotriene to their particular receptor and exert their actions. So there are three types of leukotriene receptor antagonists are observed. One is zafirlukast, montelukast, and xylutin. So zafirlukast is marketed as Ecolate. In the sense, in the marketed drug Ecolate, the zafirlukast is present, and in Singulair, the montelukast drug is present, and in Zyflo, the xylutin drug is present. These all are leukotriene receptor antagonists, means they prevent the binding of leukotriene to those receptors and exert, or else they prevent the leukotrienes to exert their action. What are the adverse effects of these leukotrienes? So leukotrienes, if released in the body, what are the adverse effects we can observe? So multiple P450 drug interactions. So P450 is such an enzyme which is released in the liver for metabolism. So cytochrome P450 enzymes, cytochrome P enzymes are such a kind of enzymes which are used in metabolism, and they are released in the liver. So multiple P450 drug interactions are observed. More amount of drug interactions are observed because of these leukotrienes. And for example, like drug interactions will take place with warfarin, as well as theophylline, as well as propranolol. So propranolol, theophylline and warfarin, if a patient is taking these kind of drugs, then leukotriene receptor antagonists, leukotrienes are not recommended, because they potentiate the action of these drugs. When these drugs action is potentiated, then it causes adverse or severe side effects. And there is some association with this syndrome called as Churg-Strauss syndrome. So this syndrome is specially associated with the endothelial tissue, and it causes, because of these leukotrienes, then what happens if the leukotrienes are released in excessive amount, this syndrome, or else this syndrome is potentiated, where it causes vascular rashes. Vascular rashes are observed, and pulmonary and cardiac conditions are worsened. So pulmonary and cardiac conditions are worsened because of the vasoconstriction. And hepatotoxicity with xylutin. So xylutin is such a leukotriene receptor antagonist which have a special side effect called as hepatotoxicity. If xylutin is given in more amount, then this hepatotoxicity is observed. So these are the fewer side effects which are observed because of these leukotriene receptor antagonists.